What's up, guys? Another Titan Talk Tuesday has begun. So I'm happy to be here. I'm glad you guys are joining in. Thank you. What's up, Cody Gorman? How you doing? CJ Mello, what's up, man? Want to say hi to everybody else. Michael Vincent. Fat Club, you guys are all joining pretty quick. Hey, what's going on? How you doing? Official Strength, how you doing? Robert, how you doing? One of them, how you doing? What's up, guys? So, Titan Talk Tuesday, it's officially started. And we are approaching Christmas. If you guys celebrate Christmas. If you don't, we're approaching a holiday. If you don't celebrate that, well, approaching some time off, I would say, right? We're going to approach some good times and some holiday spirit's going to be out there and cheer. And for you guys, I'm going to actually be giving out some holiday specials. And I'm not going to do it today. I'm going to do it next Titan Talk Tuesday. So that's going to be, you know, your cue to want to join in on next Titan Talk Tuesday. And I'm going to do specials on everything. So I'm going to do specials on blood tests. I'm going to do specials on aminos. I'm going to do specials on peptides. I'm going to do specials on everything. So at that point, if you want to try therapy, if you wanted to start getting that New Year's resolution ball rolling, here's going to be your chance. So next Titan Talk Tuesday is officially how it's going to be going down. What up? How you doing, QC Fit Males? How you doing? Tampa, CL, FF, how you doing? Julin, how you doing? It's good to see you guys. It's good to see you guys. So we got everybody out there, everybody joining in, and we started talking about we were going to give away specials next Titan Talk Tuesday, so make sure you tune in. And then we're going to start talking about some of the events that are coming up, because we got a lot of cool events coming up, especially if you're local to Titan here in Tampa right now. We got other places coming along, so get ready for Titan, hopefully going to be in your neck of the woods. I'm working on a lot of different places, so hopefully it all comes through, and we get those places running for you guys locally. But if we are not in your neck of the woods per se, we can always service you nationwide. All you got to do is call or text 727-389-3220, and we'll be happy to take care of you guys. We do blood testing nationwide, vitamin amino acid injectables, hormone replacement therapy, rejuvenation detox, hair health capsules. We've got recovery capsules, a lot of different things to help you reach those goals physically, mentally. You want to look better, you want to perform better, you want to feel better. And that's the most important thing, feeling better. Because without your health, you're not doing anything. You're not going out on a Saturday night. You're not going to a competition. You're not sitting here talking to me or listening to me or however you want to do it, communicating one way or another. You know, it's important. So I really want to stress health. I definitely want to say, you know, check your blood work and don't just go by everything looks okay. It's kind of scary out there, and I'm going to give you a personal example. A personal example is my father. My father is diabetic. Nobody diagnosed him as a diabetic until he started getting blood work through Titan Medical Center, and we started looking at hemoglobin A1C. So hemoglobin A1C is a 3-month reading of your glucose levels. No matter if you're fasting, not fasting, it will tell you if you're pre-diabetic, diabetic, or where you stand. So at that point, you know you better clean up on your diet. You better exit out those sugars. And at that point, you might need some medication that will help you regulate, moderate, or even lower that hemoglobin A1C so you're in healthy levels. The reason you want your levels to be low, especially in sugars, because we know when high sugar levels in the blood happen, cells start to deteriorate. It starts eating. And that's why people lose limbs, eyeballs, and their health starts to deteriorate. So at that point, you want to make sure that you're looking for these silent killers, is what they call them. That and high blood pressure. High blood pressure is another one. My father's got high blood pressure. You know, and what do these two things do? Silent killers. Why? Because over time, they start deteriorating your body or even attacking or hurting the organs, like the kidneys. So kidneys and your liver are important, right? Now, you might think that you have 2 kidneys, and you're like, well, if one kidney goes, the other one's going to be okay. But usually those kidney functions are reading of both kidneys. So usually people need kidney transplants because both of those kidneys are not working optimally or not functioning properly. So at that point, it's really, really serious, guys. Dialysis is no joke. I know a lot of people that are on dialysis. I don't want to be on dialysis myself. I don't want to see anybody on dialysis because, man, it is something serious to do. And you have to be consistent with it no matter if you want to or not because it's your health. And you could die or hurt yourself even more. So at that point, I just want to, excuse me, I did that backwards. I want to just hone in on you guys, tell you guys about it. I'm not going to harp on it. All right, so what do we got coming up? So this Friday, December 14th, from 6 to 9 p.m., we're going to be at the Godfrey Hotel here locally. It used to be Water. Now it's the Winterland. So at that point, they've decorated it tremendously amount of decorations and lights. I was really impressed when I seen it. All the little cabanas were dressed up as gifts and everything like that. So we can't wait. It's going to be the ugliest holiday sweater. So at that point, local families in need of the holiday season, that's what it's benefiting. So it is benefiting charity, guys. And we're all about charity and actually giving back to our own community, man. That's what it is. You got to invest in your community. Because if you don't, bad things happen. You don't just work together, be good. What else we got going on? So at that point, we've got some different things going on. December 22nd, we are the main sponsor of the VIP lounge for the Jason Skeldon, Hollywood Hamilton runway and art fashion show. A lot of cool things. If you know Jason, like I know Jason, of course I know Jason really well, it's going to be an awesome event. Really, really, really cool fashions out there. They're going to have stilt walkers, I think, and all these different entertainers. So at that point, it's going to be a great time. Me and Sharice are going to be there. Tight Nets are going to be there. So at that point, come out and join us. Like I said, we're all about giving back to their communities. We want to be involved in the events. So at that point, come out and join us because life is about balance, guys. Don't be extreme. Going one way in one direction is not a good thing. Make sure your life is balanced. So let's talk about the therapy of the week because now we're going to get in the nitty gritty. So the therapy of the week is BPC 157. So what is BPC 157, guys? Do you guys know what BPC 157 is? If you don't, BPC 157 is a peptide. It's a peptide made up of 15 amino acids. It's a peptide basically from our stomach acids. And at that point, it's really, really good for the body as far as defending against and preventing ulcers or stomach issues. So at that point, BPC is great for, they say, healing a lot of different areas. It helped me in a number of different ways, from shoulders, golf elbow, tennis elbow. I use BPC 157. I was really, really skeptical when using it because at that point, I'm like, all right, yeah, they say this thing is like, going to heal wounds and all this stuff. And at that point, I was just really skeptical. So I was hurting really bad. I was, willing to pretty much try anything because when you have those ailments, every easy movement is it's a pain. Like if you have golf elbow or tennis elbow, right? You know how that is. And at that point, even just resting your arm on the hand rest somewhere is a painful thing because it's like that little funny bone right here. So at that point, you're going to really willing to try anything. I went on Google. I did hand exercises, all this different stuff. But BPC 157 was the only thing I really could go with. That with IGF-1. And I really did just use the BPC 157 to see, is it going to help? Is it really going to do what they're saying it's going to do? And it really did help. So it's helped a lot of different patients. But I usually always try these therapies first just to see how it reacts with me, how I go on the therapy. Is it going to make an impact for the patient? Because at that point, I'm not going to tell you about something that I don't use. I mean, it's unethical and I wouldn't do it morally. So at that point, I can't put my name behind something that I don't really believe in. So at that point, BPC 157, I really do believe is a game changer. I mean, as far as that goes, if you have ailments and stuff like that. Now, BPC 157 or TB 500, which they both work great together synergistically. Systemically, the TB 500 works. So that means you can inject it pretty much anywhere in the body, and it's going to work everywhere throughout the body. Where BPC 157 is usually site injection specific. So at that point, you want to go closest to the ailment of where you're having the problem at. Now, what I was getting at is BPC 157 and TB 500 are not guaranteed, and they're not going to fix all ailments. Some guy said he had a shoulder out of socket, and would this help that? It's not going to help that. It might help inflammation, okay, but it's not going to help putting the shoulder back in the socket. So at that point, guys, please, it's not the wonder drug. I know they call it the Wolverine healing peptide and stuff like that, or these things work together, and they've done just like dramatic things, and they've worked for a lot of different people in a lot of different scenarios. But there's just some things that are just out of touch and out of mind. So let's just let's be in reality, guys, and some of the things we're asking for. All right, I've actually had some orthopedic surgeons use these peptides, and actually in place of, he didn't want to get surgery. So he's like, John, I'm willing to really try anything. I don't know about these things as much as you do, but hey, listen, let's give it a try. So basically, I mean, he's a really believer in it now, where he's, sending and referring patients over from his practice that he thinks they say, these people want to try something first before they do a surgery, because the surgery is going to be more intense. It's going to be more of a healing process, and can put more shock and damage on the body, and it's possibly, at that point, they want to be able to heal faster, or they can't be able to work as long, and they're willing just to try something because they don't want to go underneath. Then they don't want to go underneath the knife. They don't want to do the anesthesia. It's very rare, but some people don't wake up from anesthesia. I mean, any surgery I have, and I've had a couple surgeries where I've had to go underneath anesthesia. I always think about it. I'm not scared about it, but hey, listen, things happen. So I'm always prepared, and I'm always in the back of my mind, hey, listen, anything can happen. Worst possible scenario, best possible scenario. I always implore you to think about both ends of the spectrum. Because if you think about the worst possible scenario and you're okay with that, that is the worst thing, and you're always thinking about, hey, listen, that's the outcome. And if something positive happens way over that limit, then at that point you're really, really happy, right? Because it was unexpected and you weren't expecting it. Don't expect things. Don't expect things from people. Don't expect things from anything that you're prejudging or stereotyping. Get the real deal. All right? So let's talk about some more therapy. So with Christmas or holidays or family time or days off coming up, whatever you celebrate or however you want to spin it, at that point, what's going to happen? Usually you're going to be gorging on some great holiday or free fun food. So that could be just eating Christmas pies, or eating a whole bunch of turkey and ham and pork, just gorging, right? So you don't want to gorge. But if you are going to gorge, per se, like you're going to eat a lot of different things that you normally wouldn't eat, or you're going overboard on things that you don't eat too good anyway, and you're just adding more on top of it, what you're going to want to do is, listen, you're going to have to combat that in some way, shape, or form. If you're going calories in, you got to get calories out. So calories in, and not all calories are the same. So if I eat Twinkies and I get, let's say, and I'm just throwing it out there, 500 calories from a Twinkie, I'm not going to, get the 500 calories I got from chicken the exact same way, right? Yeah. So it's not going to affect the body. It's not going to be, the nutrition factor is not going to be there. Let's just put it like that. Nutrition is the big thing. So at that point, you're going to have to get these calories in some way, shape, or form, whether it's some sort of exercising, running, cardiovascular programs you might be on, anything to really get that body up, get the core temperature up, get the heart rate up, and really start burning fat, which you can start burning calories. So at that point, you're going to combat that. So always keep that in the back of your mind. If you overindulge or you're gorging or anything happens like that, you better kick it into high gear. This is another thing I tell patients. Patients always ask, this is a really common question. Hey, John, when do you think I'll be seeing results, and how fast am I going to be able to look like that? And they'll put in a picture or whatever, or they'll send me, over something they would look like maybe 15 or 20 years ago. I always say, hey, listen, how long have you been on those unhealthy habits? How long have you not been working out or doing any form of exercising? How long have you not been doing some sort of diet, per se? And I'm not talking about diet of starving yourself. I'm talking about a diet of clean diet, or somewhat clean, a balanced diet. How's that? So at that point, they always say, well, I haven't worked out in like 10 years, man. Well, guys, you're going to have to give it a little bit of time to get those results. I don't care who you are. There's not no magic pill or magic injection or anything out there that's going to expedite those results that fast. Now, you can get faster results or expedite your results, yeah, for sure. But everything is patient-specific to a degree. Genetics come into play, right? How long you have been out of the gym, what's your current status as far as body fat wise and muscle and all these other things that, you know, come into play. So at that point, think about it and don't be hard on yourself. Now, you should be hard on yourself, harder than anybody else is. You should be harder on yourself. And that way you'll push yourself. Even if somebody's not there, you're pushing yourself. Now, everything that I've done and achieved, and I'm not the biggest guy or anything like that, but I've definitely made some far and great improvements with my body. I've never had anybody there to train with me. Have I got the guest train with one or two guys like a day or so? Yeah. But as far as that goes, nutrition, all that, it's been me. I've learned from some things. I've read. I've done other things that have gave me knowledge, worked with the doctors, blood testing, and stuff like that. So it's given me more knowledge as far as to put these things together to get these optimal levels. And that's what you want to get at, right? You want to get optimal levels. That way you're getting optimal results, optimal health. You know, and optimal levels means a lot of different things. It doesn't mean pushing one hormone up farther than all the rest. You have to have a balance in those hormones and make sure those hormones are where they need to be numbers-wise and where you're getting feeling-wise too, because that goes hand in hand. You know your body better than anybody else because you live in your body. So at that point, you should think about what is going on in your body. So when you're thinking about what's going on in your body, just make sure you're feeling it, make sure you're blood testing, making sure everything's right. So optimal levels, that all goes along with that. All right, you're as young as you want to feel. That's exactly right. And you guys on Instagram, you guys need to go over YouTube after this. Check out the awesome graphics we're doing. Thank you, Art and Andrea. So these are awesome. And at that point, you feel as young as you want to. So at that point, age is just a number. I put out some of these things on social media, so it would kick some of you guys in the butt, man. Now, some of you guys are younger in the 30s and you guys aren't feeling good. Guys, there's a reason for that. If you guys are holding belly fat, if you guys, you know, aren't getting proper sleep, if you guys are lethargic, right? Or just recovery sucks, you guys might want to check out your hormones and make sure you're good. There's a lot of these different symptoms that these people call up and say, I just want weight loss. I ask them their age, they're like 35, 40 years old. They say, I want weight loss. Have you ever had hormones checked? No, I haven't. You know, I'm 40 years old. Well, that's one thing, the first thing you should go check. I say that to every patient that calls. I'm like, listen, we can help you out losing a couple pounds with the ECAs or Tighten Up or Tighten Complete. Yes, we can get you some weight loss. But is it going to be permanent weight loss? I don't know at that point, unless these hormones are right, because things aren't going to work properly because they're not at optimal levels. They're not at healthy levels. It's just like a car or anything else that you don't have on a proper level that it needs. Tires and air, and air pressure, oil, fluid, anything else. If these things aren't right, these things aren't going to work right. So, guys, make sure you guys are checking in optimal levels and make sure you're performing good. So, weight loss, ECA Stack Plus. I know we talk about it a lot, but I want to go over it so you guys understand. So, ECA Stack Plus is great because it's been around a long, long time, right? Ephedrine, caffeine, and aspirin, that's the original ECA stack. And the reason they call it stack is because you're stacking the three components together. I seen some guy said, you call it stack, it's supposed to be in a bottle. That has nothing to do with it. But this is doctor prescribed and comes from a real U.S. licensed pharmacy. So you're combining ephedrine HCl, caffeine, aspirin, and for our extra stack plus, there's B12 and chromium in there. So you're getting great weight loss, you're getting fat burning, you're getting concentration, you're not going to get any jitters, no heart palpitations, right? You have that B12 and chromium to help boost the metabolism naturally. So you're creating a great environment for weight loss. At that point, you will like the fact that you have more energy instead of having to drink Monsters or Starbucks all day, Red Bulls, whatever you guys are drinking out there, because you guys are getting these other components, fillers, carcinogenics, stuff like that are in these drinks that is unhealthy for you. So why are you taking these things in when you don't need to? That's the cold hard facts of it. So I mean, at that point, you should really look into that. ECA Stack Plus, Tighten Up, Tighten Complete. So stacking these two together. So you'll have an injectable and an oral form. If you guys know about Tighten Up or Tighten Complete, if you guys don't, please let me know. ATG weight loss, that's another one you can use. Now, ATG weight loss is for calorie restricted diets. So what about being energy? So one of them, what about being energy? So if you want energy, ECA Stack Plus is awesome. What can MK677 do for you? So I'll bring it up. I'll talk about it. Yeah, no problems. I like the questions, and I just like to shoot them out. So MK677 is an oral GHRH. What that means is a growth hormone releasing hormone. What is it going to do for you? So MK677, the studies on it have shown to raise IGF-1 levels, which is insulin growth factor 1. And what does this do for you? This does a lot of the anti-aging effects that people are looking for, that they want to feel more energy, they want better skin, better hair instead of brittle hair, right? Libido is supposed to help. It's supposed to help a lot of different things. It's like the anti-aging effect. So at that point, that's what MK677 is going to do for you. Now, some of the side effects from MK677. So it does stimulate hunger. I don't think it's as bad as GHRP2 or GHRP6, which are growth hormone releasing peptides. It's not as bad as that. But it does stimulate the hunger. So at that point, you're going to want to eat as clean as possible, and that's okay. Now, there's guys out there that want to gain a lot of weight. At that point, this could be, a metabolism booster, stimulate the appetite. So at that point, you can get some more food down your throat to hopefully get you some more of those gains, right? And lean muscle is what we're after. We're after lean muscle because quality over quantity every time. Now, the more muscle you have, the more fat you're going to burn. So that's really, really key to think about, right? And the lower body fat percentage, the better. We don't want to be too skinny, and we don't want the body fat percentage to be too skinny or too low. But MK677, now, some of the side effects patients do call in about sometimes, and it's different for everybody, is they do possibly get some water retention the first week or two. It does usually subside, but it is something that we like to tell our patients right up front because girls especially, and I'm not picking on girls because I love the ladies, right, as friends. But at that point, they don't want to get bloated. They don't want water retention. They might have some big event coming up or something like that. And if they take this and they do possibly get some of those possible side effects, then they might be upset. And I don't want to be the man to blame for that. So at that point, I want to let them know right up front what's going on. But it is great for that. So, and it's great because it's an oral version. It's the only oral version that's out there that works that we've seen. At that point, basically, if you're not, scared of the little injection, the little insulin needle, subcutaneous, you can take CJC 1295. Now, there's not usually no water retention or anything that goes along with that. And it doesn't stimulate hunger like MK677 or GHRP2 or 6, not to that effect. So at that point, that might be a better option for you if you don't want, possible water retention or bloating or whatever it is that the patients have went through. So I just want to share this experience with you because I think it's important to share it. That are laws. Should I stop taking my B12 shots since I have heart palpitations? I have a mechanical heart valve.
Ooh, that's rough.
Okay, so I'm not a doctor. I want to put that out there. I'm the owner of the clinic. I'm not making any recommendations for you to do anything like that. Check with your cardiologist. I'm sure you have a cardiologist if you have heart palpitations. Now, B12 usually doesn't cause heart palpitations. It's a vitamin that is produced and it's in our body. So at that point, our body, it's not something that's unrecognizable or something you can even overdose on. You excrete B12 out of your system through urine and stuff like that, so it's not toxic. Vitamin D and vitamin E, especially vitamin D. Vitamin D is oil-based, and vitamin D can be toxic. So you don't want to overdose on vitamin D, as in dog. At that point, a lot of people are vitamin D deficient. They don't even know it because they don't even test for it in your primary care. That's a test we run for $25. And guys, I live in the state of Florida, and I'm vitamin D deficient, and I'm tan. How is that? I go out in the sun. Look at me, Everybody calls me Italian. I'm Greek. So I guess Mediterranean is just a thing. So, but it is what it is. But that's one test that I really, really want to push, into your mind. If you don't get it tested through us, get it tested through your primary care. Just say, listen, I want to run a vitamin D test. I think I'm vitamin D deficient. Okay, I want to see this vitamin D supplement that I'm taking is working. Please, doctor, help me. If they don't help you, go somewhere else. They should help you, especially if you're saying those things. Those are kind of like cries for help. Like, what up, Matthew? How you doing? So at that point, just think about it, right? Vitamin shots are key. So all the vitamin shots have different benefits, and we blended some of these great vitamins and amino acids together to give you maximum benefits, because that's what you're all about. You want to get maximum benefits. Hercules Potion is the bomb. Thanks, Gilette. How you doing, man? Thank you. So Hercules Potion, that's like one of our number one components of vitamin amino acid injectable therapies. It's awesome. It does combine some of the great things like, glutamine, arginine, ornithine, lysine, L-citrulline, taurine, proline, NAC, and L-carnitine. So at that point, you're getting a lot of different effects in there. What are you getting out of it? I'm just going to break it down for you, the basics, right? Glutamine for recovery, arginine and L-citrulline, a precursor to nitric oxide, vasodilators, open it up, give you that long-lasting pump. You're going to have ornithine, which is going to let you work out longer, more strenuous activity in anything you do, running, hiking, jogging, walking around at Disney. I always bring that up because I've done it, so I'm using a real-life scenario. NAC is a great liver protection, okay? L-carnitine is great for weight loss. Proline is a collagen-based amino acid. It's going to be good for lubricating the joint area, like shoulders, guys. I know a lot of guys out there have shoulder problems, especially the older we get. The more wear and tear we put on our bodies, the more abuse it's taking and the more beat down we're getting. So try to protect it as much as possible, all right? So Hercules Potion, yeah, that is definitely one of my favorites. I don't train without it. I love that stuff. It's really, it's a game changer. And I can talk about it all day. Until you really try it, you really don't understand the effects that you're going to get. I've had some people write me recently that have known my company. I've had great communication with for years, like three years now. And, them recently just getting to try the Hercules Potion. And them saying, I cannot believe how good this stuff is. And I'm sorry that I didn't try it earlier, and I will not train without it ever again. That is a huge compliment to us at Titan Medical Center, because nobody else out there has Hercules Potion. Nobody has that blend, okay? That is something that Titan Medical Center has. So at that point, it's something it's natural. It's going to give you the things that you're looking for. It's going to give you a higher absorbency rate than anything orally you're going to intake, and a faster transportation rate. So that means it gets in your body faster and your body absorbs more of it. So the only faster way is to get this into your body would probably be an IV. And that is not, you're not going to do an IV every day, right? That's not optimal. That's not something that's, viable and something you can do every day. So at that point, this is the best way. A little insulin needle this big, you do it. You can spot inject it. You can give it into different muscle groups, maybe that you're lagging on or had atrophy in because of an accident. I have a whole bunch of people that always come to me and say, listen, I was in a bad motorcycle accident. I have atrophy in my quads and my leg, my left side, right side, and I've been using this, and it's actually helped kind of get these things back together. And the real way to do it is, you can do a bioscan or whatever it is, and make sure, the muscles are at the exact same, as far as symmetry wise, and as far as how much muscles in one leg compared to the other. We have the test here that we can do it for in-house, but if you're not in this area or not local to us, there's a whole bunch of people that are out there that have these machines that can help you out, and so you can really see what's going on, right? All right. So what does this say? Good for ladies too. I'm 47. This is my first month of taking it. I can't explain how great I've been feeling. So yeah, so she is a lady, and this is awesome. 47 years old, kicking strong. I love it. Hey, listen, if you're a patient, right, and you haven't got, if you're a lady, a tank top, or a male, a V-neck, you call or text 727-389-3220. That's the number you call for your refills, and you've called before to sign up. You can call or text that line. You deserve a Titan tank top or a Titan V-neck. If you're a Titan patient, you have one for free coming to you. You have a tote bag coming to you for free, and you have a pen coming to you for free. Guaranteed. All right? I might even stocking stuff because it's Christmas time or holiday time or time off time. Some leggings in there for you ladies, or something different for you guys. You never know. I'm in the giving mood all the time. I love our patients. I love our supporters. So I try to give back as much as possible. And anything I can do, I will. So, yes, Mark, you love free, right? So, listen, anytime. And you know you guys sure coming anytime. So our patients, I want them to feel proud of being part of Titan Medical Center. I wear the shirts every day, no matter where I'm at. My clothing is always Titan Medical Center. I'm very proud of the name that we brought to the forefront here. And so at that point, I appreciate all you guys loving Titan as much as me and then wanting to support us, wearing the gear, getting the therapies, and really, really benefiting from what we're doing. So that's huge. All right. Hey, at the end of this, I'm going to give away free Titan gear anyway. So if you're not a patient or you want to get something for maybe your girlfriend or whatever it may be, I'm going to give away, it's hashtag Titan gear. You're going to call, you're going to text it to 727-389-3220. How you doing, Big Dan? All right. And then the gift certificate, the $100 gift certificate, hashtag Titan gift. So you're gonna text that to 727-389-3220. All right. So New Year's resolutions. Are you guys ready for your New Year's resolution? I think I am, right? I always want to progress. And New Year's, it's not a different day, so I'm not going to say like, oh, New Year's is here, I'm just going to turn the 360 or 180, and it's going to be totally different the next day. All right, it's not. But it always does plan for me, or puts my mind into plan mode of what I'm going to do starting January 1st or 1 week prior. And the reason I do 1 week prior is I'm getting myself mentally ready and mentally focused to hit the ground and running and starting that routine of whatever it's going to be at least 1 week before. Now, I know it's around Christmas time and stuff like that, but the day after Christmas, you have no excuse. You have nothing at all. The only excuse you have is I ate a lot or I didn't eat a lot, but I'm going to start my regimen or my healthy habits today. Start it one day at a time. Hopefully, you can get that healthy routine, and then January 1st, you're good to go. If you only got to tweak on some things, that's even better. Get that summer body now. That's what I like to say. So get summer body in the winter time. All right, you guys, especially in Florida, you're the boss. Thanks, Big Dan. I appreciate it, man. All right, so the Health Bible, the Ultimate Health Bible. All right, I'm very excited about this, guys. So if you didn't know, our book came out, The Ultimate Health Bible, Your Guide to Anti-Aging for Fat Loss, Anti-Aging, and Disease Prevention. So at that point, our book is officially out. It's been on Amazon, I think, like maybe 2 weeks now. Maybe a week and a half, 2 weeks. It's actually done pretty well. I'm very excited. My guy that was writing it with me, so me and Jeff Bahar, wrote that book together. We put a lot of work into it, a lot of effort into it. It's on Amazon. That was huge. It got published, so I'm huge with that. And now I just learned today that it's in Barnes & Nobles, right? It's online, it's in their store, and then they'll be carrying it in the hardback edition. And then I'll be doing signings locally at Barnes & Nobles. So if you guys are in the Tampa Bay area, if you guys come out, I'll sign a book for you. I'm really excited. I'm just happy to be an author and happy to have this out. So it's got a lot of great knowledge in there, guys. So whether you're a beginner, you're not a beginner, this has a lot of different things that you might not have known or that might add to your knowledge. And at that point, as far as nutrition-wise, disease prevention, fat loss tips, eating habits, styles, hormones, blood testing, there's a lot of different things in these chapters. They're going to help you. I guarantee it. I guarantee that you will learn something from this book, no matter what level you're at. And if you're at the amateur or beginner stage, this thing is going to give you a lot of shortcuts to a lot of different things that you might have questions to, that you might pay a lot more money for. I think this book is like $25, and there's a code right now out there. I think it's like $18 or something like that. I'd have to look. But it's crazy, right? So at that point, you can get all this knowledge. Now, if you're going to read it or not, listen, you go to the bathroom every day. So if you read a couple pages every day, it's going to give you knowledge. You're like, oh, this is cool. And you might be able to apply that to your day. So it's cool. And you can apply it over time, and it's going to give you better results. It's going to give you this knowledge. And knowledge is power, guys. Knowledge is everything. So learn as much as you can. Every day I try to learn something new. It's huge, man. I just go on there. I'm like, all right, what do I want to learn today? Especially with the internet, Google, YouTube, forget about it. All right, so what else? What are questions? Biggest difference between Titan Complete and Hercules Potion? From my man, Justin Holt. What up, Justin? All right, so let's answer the man's question. So, with Hercules Potion, you're not getting any of the B vitamins that you have in Titan Complete, and you're not getting the branched chain amino acids, and you're not getting MIC. So, you're not getting the methionine, acetylcholine, choline, right? You're not getting the B vitamins, like the B complex that's in there, the B12 that's in there. You're not getting any of the branched chain amino acids. So leucine, isoleucine, valine. The only component that is the same is L-carnitine in there. That's for weight loss. But as far as that goes, it's not going to have any of the components of Hercules Potion. So you're not crossing over per se. You're not double dipping. They're going to work synergistically together. Awesome. I put those two together all the time, like peanut butter and jelly. That's what I like to call them, because they work great, especially together. Because usually Titan Complete, you're taking in the morning time with those B vitamins. You're boosting metabolism early. You got those branched chain amino acids. So at that point, you're starting to get off great. Where Hercules Potion, you want to take that before the activity, right? Strenuous activity. So at that point, what's up, guys? How you guys doing? Nice to see you guys all. I'll answer your question on one thing about the TRT. So at that point, you're taking the Titan Complete, you're getting that boost in the morning, you're taking the Hercules Potion before the strenuous activity or workout or whatever you're doing. And at that point, you're getting the recovery, you're getting the muscle pump, you're getting all the other benefits Hercules has, the Titan Complete does not have, because they don't share those components. So you're not double dipping. You guys are getting a lot of benefits from these two injectables together. Okay? So good question, Justin. I appreciate it, dude. Is there an audiobook? I don't think there's an audiobook. I got to ask the publisher. I don't know.
It's a chick reading.
I don't know. Is it? Listen, Justin, I'm not sure. It's a good thing. Maybe there is. I'll see about doing it if there's not, because I know somebody could like put it in their AirPod or and they're rock and roll into it. So. And they can just listen to it whether they're doing cardio or walking around or whatever they're doing. So I will ask about it. Thank you, Justin. I appreciate it, dude. When on TRT, does it make you fatigued? So no, you should not be getting fatigued on hormone replacement therapy. The reason you might be getting fatigued on testosterone replacement therapy. Now there's two different things. Testosterone replacement therapy means testosterone replacement therapy. That means you're only taking testosterone, right? HRT is hormone replacement therapy. That means you're balancing hormones. That might be 3 hormones. It might be 4 hormones. It could be 2 hormones. But you're going to balance these hormones. So at that point, usually people start getting fatigued when they have high estrogen levels. And the reason they have high estrogen levels is because usually they're going to a doctor that's only giving them TRT. And that's testosterone replacement therapy. Their testosterone level goes up. That's great. They start feeling better in the beginning. Then they start feeling fatigued. They start having water retention, possibly getting fat deposits. At that point, sensitivity issues, crying to very sensitive commercials or sad movies. Okay? You don't want that. You're a man. All right? So at that point, when you're having these symptoms, it's because usually high estrogen levels, and we know testosterone is going to aromatize and convert into estrogen. So at that point, what's going to happen is your estrogen is going to go high, and you're going to start getting these symptoms, and that's when you might be feeling lethargic or sensitive, or the belly fat or body fat that could be getting put on you. So watch out for that. All right. So make sure. And if you are on hormone replacement therapy, let's say through us, and you're having a negative side effect of some sort, call or text us. That's why we're here for you. We're concierge medicine for you. We're here for you. So at that point, we're not like your other doctor's office. We don't just want to give you medications and send you on your way. We want you to be in communication with us so we can help you get the optimal results that you're looking for. That's why you're paying us out of pocket, right? That's why Titan Medical is here, because that's what we founded ourselves on, is patient service, patient standard, and awesome first-class therapies and clothing to go along with it now. All right? All right, so what up? How you doing, Imagine Fitness? All right, been running complete in the morning at Hercules before gym. Freaking awesome. The Punisher 80. Awesome, bro. Thank you. I appreciate it. I really do, man. Your feedback, man, is really, really important to me. Thank you, man. I got some of the feedback yesterday too. That's, to that, it motivates us here at Titan Medical Center even more, which is another one part of my New Year's resolutions is, it's just motivating me more. We got some big things planned for 2019. I'm just keeping a lid on until, we're ready to just pop it off. So stay tuned because we got other things planned for that. So that's awesome. So, all right. Hey, your info is always awesome. Does the book have diet tips as well? Yes. So Blues Tab. So the book does have diet tips in it. It talks about the foods and stuff like that. Jeff really honed in on some of those things. It was awesome, man. So I really, really think that you will benefit from that book, especially if you're looking for nutrition, guys. And I'm the nutrition guru. Jeff, it really does. He's got it down to a science. I've learned a lot from him. I know he's learned a lot from me. So at that point, this book, I'm telling you, I promise you, if you don't like the book, you let me know. And I'll possibly refund your money. But I'm just telling you, I don't think you will. Do you carry SARMs? So SARMs, select androgen receptor modulators. All right, that's what a SARM is, right? We don't have SARMs at the pharmacy. We aren't the pharmacy, so our doctors don't prescribe the SARMs, and the SARMs, they're not produced in the pharmacy. So select androgen receptor modulators, no, okay? MK677, they were calling that a SARM, but that's not a SARM. So don't get that mixed up. So if you are looking for that, we do have that. That is a GHRH, a growth hormone releasing hormone, all right? All right, cool. All right, so we've talked about the Health Bible. That's our book that came out. One more other thing is going on. So I have a speaking event here in Tampa. And that event is going to be really, really, really cool because it's not just me speaking. There's I think 6 or 7 different speakers. I'd have to look. I'm going to put the link up so you guys can see it. So at that point, just click on it and see who's going to be speaking. Some of the guys that I know personally would be like Chris Cavallini, so he owns Nutrition Solutions. He's got a really good story. He's been pretty hot lately. He knows a thing or two about starting from nowhere and getting somewhere. Cody Mannix, he's putting together awesome dude. I know he's been through the ringer and he's done an amazing job of doing what he's been doing and motivating people and stuff like that. So the Conversion and Marketing Summit is what it's called. We have 30 days, I believe, or a little bit short. It's January 12th and 13th. So at that point, get your tickets now. Use the code TITAN, all capitals, TITAN. And at that point, you guys will get a discount on the summit, on the tickets. I think it's a weekend thing. I will only be talking, I think, one time, and then I think we're having a gathering, a VIP dinner, which has all the speakers and you. So if you get the VIP, I think you get to talk to all of us, and we get to sit down. You get to ask us questions and stuff like that. I'm going to be covering my story, how I got to where I got to, what I went through, where we're going to be going. And at that point, I'll talk a little bit about the book, the franchises. The franchises are going well. If you guys want a franchise in your neck of the woods, call or text us here at the office, 727-389-3220. Let one of the girls know, and I'll have somebody get in touch with you. But we have a lot of different areas. So it's all over the United States, guys. We already service the whole United States, but we're looking in every other state. And we've already got some states possibly locked up by some people, but you never know, so here's your chance. Or if you know a doctor that you think would benefit and bring a Titan Medical Center to a town near you, maybe you can work out some great deal with him and have him come in as a Titan Medical franchisee. It'd be really, really cool too. So I'm trying to think what else. I think that's it, man. I want to show some of the new clothing off. So I've got some really cool stuff. Now, guys, I'm working on all your new cool stuff. I got more Nike stuff coming for you guys. I've got some really, really cool, like sleeveless hoodies, stringers for the guys, joggers, all kinds of cool stuff. So I'll be bringing that out to you in the next couple of weeks. But for now, I think this is really cool. So for girls, we got all the camo, even the green camos in. These would be great for your lady too, man. I'm telling you. I don't think any of the girls that I've gave these to has ever said, I don't like these leggings. They're really expensive leggings, guys. So it's really hooked up. I've got the whole outfit so they can look fly, right? You want to feel good and look good. That's what it's all about. Feeling good and looking good. So you got that. We even got the headbands. So this is a new item. These are going to be cool. I think this is upside down.
Yeah.
Oh, yeah. All right, sorry about that, guys. So you guys can read it. And I know it's looking backwards on the camera. So, but
cool.
Guys, even if you have a man bun, you guys can use this. All right. So we don't discriminate here at Titan. We love you all. All right. Titans come in all shapes, colors, sizes. All right, guys. So I think that's been enough for Titan Talk Tuesday. Perfect. I actually went over my time by 15 minutes. Easy.
Yeah.
I love talking to you guys. So at that point, listen, if you're on YouTube, press subscribe, please. I need all you guys to subscribe. And if you're not on YouTube, go to YouTube and subscribe because I've got all the videos. All these are on there. Titan Talks, our educational videos, our cool behind-the-scene videos, Titanette videos, workout videos, and more cool videos to come because I got an awesome team behind me that's working on all this great stuff that we're going to produce for you guys. So I can't wait to show you guys that content. So just go there, subscribe. Instagram, please share this with your people at the bottom and then 3 different names. Please tag them in this at the bottom on the comment section. Facebook, you know what to do. Share this. Please share this to your page. Share this to the group. Share this to a friend's page. Or 3. However you're feeling generous to me. I really greatly appreciate it. All right. So I think that's it. I'm John from Titan. And wait, your thoughts on CJC 1295? Answer one more question. All right. CJC 1295. It's a GHRH, growth hormone releasing hormone, injectable. Its predecessor was Semarelin. It's better than Semarelin because Semarelin is a GHRH2. It lasted the body longer, so longer half-life. At that point, it's supposed to work better all the way around. All our patients are converting over to the CJC 1295 if they want to do an injectable GHRH instead of Semarelin. Usually, after 6 months, Semarelin really doesn't work too well for patients, but the CJC has a longer as far as that working life pretty much. So at that point, past 6 months, patients are still, getting good results. And that's the main thing, guys. You don't want to take something over and over and over and not get good results. At that point, you're going to be, a little, like, hey, listen, what's going on? A little upset maybe, just like, hey, what's going on? So at that point, I don't want you guys to feel like that. I want you guys to feel like you're getting good results. So CJC 1295, it's a great one, man. Great peptide. Injectable GHRH that Titan Medical Center offers. All right, guys. I'm John from Titan. I appreciate it. I'm out.